네, 잠시 안내 말씀 드리겠습니다.
Ladies and gentlemen, may I have your attention, please? Shortly at 1:30 p.m. Korea Standard Time, Bio Invest Fair 2022 will begin. For those who are joining the event, please make your way into the venue and be seated. This event is following the guidelines for social distancing and quarantine to prevent COVID-19 pandemic. Please maintain social distances and please make sure that you wear your mask the whole time. And this event is going to be aired online as well. And I would also like to let you know that company materials and presentation decks and event information can be downloaded at the official website. In addition, Biokorea Invest Fair 2022 will begin shortly. All the participants who are joining us today, please turn your mobile devices on vibrate or silent mode. And in addition, this event is going to provide simultaneous interpretation. Please turn on channel 1 for English and channel 2 for Korean. And as you leave the venue, please make sure that you leave your interpretation receiver on the table. Shortly, we're going to host our guests of honor and then begin today's event. Thank you for your cooperation.
네, 여러분 안녕하십니까?
Good afternoon, ladies and gentlemen. Welcome to the 2022 Biokorea Invest Fair. My name is Sun Young Park. I'm your MC for today's event. Despite your busy schedules, we are joined by guests of honor and all the officials. And I would also like to thank all the participants who are joining us on site as well as online on our YouTube channel. Biokorea Invest Fair 2022 is an opportunity to talk about how to go global, the global biohealth industry, and many different industry personnel, including pharmaceutical, biohealth, medical health, and healthcare companies, are joining all together to talk about the technological cooperation and the vision. So it is my great honor once again to be here to be your host. And I hope that your business can grow by taking this opportunity provided to you today. And despite the difficult times, thank you very much for joining here on site at this very venue. This forum, unfortunately, was not able to invite a number of guests in order to prevent the spread of the COVID-19 pandemic. But on our official website, we're airing our show in real time. And at the venue, we are joined by domestic speakers, the host organization, and the organizer so that we can follow social distancing and mask wearing practice advised by the Korean government. And as the first order of today's event, I would like to invite Chairman Kwon Sun Man at the Korea Health Industry Development Institute. Ladies and gentlemen, let's give him a big hand. Good afternoon, ladies and gentlemen. My name is Sunman Kwon, President of the Korea Healthcare Industry Development Institute. I know that my employees have been working very hard to prepare for today's event, but I feel like I look very fatigued, even though they are the ones who worked hard. And first and foremost, I would like to express my sincere gratitude to the distinguished guests from Korea and also abroad who are attending the Biokorea Invest Fair 2022. The Biokorea Invest Fair is an event where pharmaceutical, bio, medical device, and healthcare companies that research and develop innovative new drugs and products and who seek to advance into the global market can introduce their superior technologies and provide investors with corporate management strategies and vision. At this Biokorea Invest Fair 2022, under the interesting themes including metaverse and biohealth response and strategy, mRNA vaccine platform and CMO are going to be presented, and new drug development platform license out strategy, microbiome global trends and licenses, with interesting topics such as out strategies, are going to be touched upon as well. A total of 21 companies with excellent technologies, including Korean listed pharmaceutical, healthcare companies, and biotech companies, are going to participate as well. And as a special session tomorrow on May 12th, a briefing session for Korea Venture Business Investment Fund briefing will be held for 2 days to talk about the status of policy investment support for startups. In 2022, the government is planning to actively support the digital transformation of enterprises to promote welcome speeches. As he was opening today's event, and he wished all the participants to enjoy this important and meaningful forum. And let me move on to session one, which is marking the very first event of the investment fair. The theme for the session is Metaverse and Biohealth Response Strategies, and Professor Lee Byung-char from Hanlim University, Hangang Songshim Hospital is going to speak.
발표 된 이병철.
I am Professor Lee Byung-chul. Good to see you. We're building a metaverse platform on our hospital, and many people are paying a lot of attention, but actually realizing this is very difficult. So I would like to share how we have built it, and I would like to share know-hows. How the procedures were and how the status quo, I'll talk about it. So a lot of people are paying a lot of attention in metaverse. So the industries are paying a lot of attention, and especially in the medical fields, uh, they are seeing a lot of potentials. And our medical center has 5 hospitals, so it's a very big medical center. And we usually have a decade based plan. We have a mighty Halim vision announcement. We had one recently, an AI, cancer, smart diagnosis, among other high technology, are systematically built. So we are realizing this vision, and by in 2021 we added metaverse to this vision. So we're propelling this plan, and we're at the Metaverse Alliance, and we have a task force of Medical Center Metaverse and many medical corporations. We're conducting discussions. So under the field of medicine, we discuss how we can efficiently adapt this technology to metaverse, and what kind of value does metaverse bring to patients. That is also a point of interest, and how more effectively the medical staff or faculty members can make use of this metaverse platform, among other questions, are being discussed. And at our medical center, there are 2 key items here. On the left is Burn Children's Hospital, so where patients and parents and faculty members can, on the metaverse platform, implement various plans and operate a lot of treatment programs. And on the right, this is Halim Universe. This is rather than for patients, but it's for faculty staff members, where they can experience virtual reality here. So by using these 2 different platforms, we create more value. So that is why we're running these two. So when it comes to virtual conferences, nowadays it's a really big thing, and we were planning metaverse, because of the COVID-19. Now we are feeling more need to implement this, so that's why we're running this. And the Zoom platform has a lot of limitations. People have limitations, spaces and or time constraints. So there are realistic limitations that you have to expose yourself in front of others and keep speaking. So we wanted to cover those weaknesses with our metaverse. So the Children's Burn Hospital is like this. If you take a look, this is a 2D graphic based platform, and you may know that you can move around in the 2D universe. And if you join here, just like Zoom, you can see other people's faces and have discussion. So I would say this is a midpoint of a perfect transition to the metaverse. But there are people who do not really want to expose their faces, so this is an alternative. So patients and parents can participate in this burn hospital, and other preschool teachers can also participate in this platform. And if you have the internet, then it's really easy to access. Like the program is really easy to use, and you can meet others on this platform. So it has a lot of strengths. Our medical center from the past, we have been paying a lot of attention to patient-oriented programs. Like we opened flea markets, among others. And if you take a look at the down left, if you get burned, it's a disease where you can't just dismiss from hospital and go back home, but you need continuous treatment. So even after treatment, you need plastic surgery, and you have to rehabilitate, and so it has to go on. So it takes 2 or 3 years, and during the process, you have to go to the hospital and go back home and back and forth. So children their academic studies lag behind because of getting treated. So the guardians, they also have to take care of their children, so they find a lot of difficulties. So we wanted to solve this question. So if you take a look at the down right, so our hospital is running this foundation in partnership with the hospital. So why don't we build a hospital school where those people can participate in these school programs and study. And during the time, those parents can take a rest from child caring. So that is the uh, value. But if they go back home, then probably they lose the access to this education. And because of COVID, where there were a lot of difficulties, so we knew that those children, patients, had difficulties. So how should we keep working on this? So we propelled this metaverse platform to solve those questions. So the Gather Town is for patients and their guardians. So when we built this, we have a lot of professional and advanced content. So for those visitors, could get a lot of information on the metaverse platform and those guardians, and when those patients leave hospital, they can still get information through this metaverse. So in the past, we have been working on this actually offline face to face. However, because of COVID, we couldn't. So we made use of this metaverse platform to make it possible again. So our metaverse platform is to build communication with our local community, and we get feedbacks from those customers. So this is the hospital's content. First of all, is before getting burned, like burn prevention, education. So through those preschool teachers, we train them so they can educate children, and afterwards, when they get a burn, then they can visit our hospital. The procedures of treating burn. So usually they don't have any information at all about treatments, so they can get trained and educated about burns. So this is really helpful for patients and their guardians. And post management measures like rehabilitation or skin management information, and then consultation service or like commuting to hospital, among other content is used so that they can learn and see and use those measures. And this is the venue of the metaverse. If you take a look at the left, and you can see that on the corner left bottom is where you see when you access the metaverse platform. And you can pass the entrance, and the brown building is the anniversary hall because we recently had the 50th anniversary, so you can get information about the history and our development so that patients can get information about it. And if you enter the hospital, as you can see on the right, you can see the hospital lobby, the auditorium, consultation room, exhibition hall, or classroom, or playroom. So when you access a gather time for the first time, people often get confused. So we just decided to show this bird's eye view so that patients or visitors can easily know where buildings are. So they can participate in, or they can just visit those exhibition halls to see various content information. So we have a 4 week based programs, and first of all, week one was the 50th year anniversary. So it was a very big event. However, because of the COVID-19, we had difficulties having offline um, event. So we used this platform so that all the faculty members could join on the online metaverse, and then Burn Experience Journal Concert, among other festivals. On week two was the training education week for patients and their guardians when they go back to their local community. Compared to where all the burn patients were gathered together at the hospital, Instead, when they go back to the ordinary society, they have a lot of difficulties. So they find it even more convenient, comfortable to be with other burn patients. So they can relate to each other and share their experiences. So under our hospital's program, they were able to do so, and we provided safety information program, and we also had a press conference where we invited journalists to experience this virtual hospital. Week three is the week of dream and hope. So we provided this art school. We gave arts therapy or other consulting, and week four and we all had a flea market. In the past, we used to have a flea market, however, because of the COVID, we couldn't. But thanks to this metaverse, we decided to do so, and also we held a lot of exhibitions. So if you take a look at this slide, we created non-face-to-face communication platform, and we provided burn medical service and ESG management. This is the 50th anniversary event where a lot of faculty members participated here to be part of this event. So instead of seeing each other offline, face to face, but rather on this platform, we wanted to celebrate this event on the metaverse. Second is a journal exhibition written by mothers of burned children. So they drew art pieces or their journals based on their experience or inspiration. So those mothers shared the experience so that they could relate to each other. Next is homecoming day of burn patients. So there are many people who left hospital after getting treated, but they came back to this metaverse platform to share their past experiences. So it was a very warm event for the participants, so that where patients could relate to each other and felt better. Next is metaverse-based art therapy. So let's play this event. So usually it takes 4 hours going to a hospital and coming back, and if you count 1 hour of art therapy, then you have to consume 5 hours to get a therapy. So you have to miss school on that day if you want to visit this hospital. So all the time consumed, and if you use public transportation to visit a hospital, although it has been a decade after she got a burn, but still we care about how other people look at us, the patients, but their family members. My child suddenly got burned, but instead of collapsing, we chose to document our everyday life. Back then, it felt like a never ending tunnel. However, now it feels like everything has just passed, gone by. So when my child experienced burn, I just recently learned that there are so many warm people, so I feel so thankful. A new opportunity that can go beyond the reality. So they're finding new hope from metaverse. So far, all the everything was about treatment, so it had to be face to face. But recently, the hospital gave me an opportunity for this, so we feel so thankful for this. So as you saw, patients they find it difficult to go around, walk around in the public, so they found hope from this platform. And we also have supporting program so that they can go back to their local community. So we run a lot of different programs. So they all exist on this Gather Town platform in different rooms of the platform. Next is our ESG management. And we also conducted a special education through preschool teachers based on this yes or no quiz game. And there are a lot of misunderstandings about burns, so we provided education, and they found it really interesting, and they wanted to get receive another education session. So we almost failed to conduct this because of the COVID-19 pandemic. However, we decided to open a flea market. So there were constraints being online. However, we successfully and did this. And we donated the revenue to patients. And we did receive a lot of positive feedback, and we wanted to expand this specialized content. So there are a lot of education, counseling, or art therapy which do not necessarily have to be conducted face to face. So we can overcome those physical constraints. So a lot of burn patients prefer this online platform. Next is Metaverse Halim Universe. This is another platform named Ditoland. This is a 3D based, so it's more complex, but you can realize more functions. So we create various games, so those university or faculty members can experience this. And so far, we haven't completed it, but it's still working on, and we are planning to commercialize this in the second half of this year. So we are planning to keep working on it. And through this, we will provide this experience. So we're planning to receive feedback, and if it works out well, then probably other content could also use this metaverse platform. And here, we're running a lot of different programs, so we accumulated a lot of know-how, and we learned what kind of specific things that patients find it comfortable to use. So we created an opportunity for communication and harmony. So even after the COVID pandemic, I think we will keep working on this metaverse platform, so that patients and guardians can get a lot of value from this. But limitation is that a lot of people still haven't experienced this, so there are many constraints that cannot be realized by metaverse platforms. So we have strengths and weaknesses. And after the COVID, if people return to face-to-face society, we're not sure how many people will still want to this. So we need a lot of improvements so that we can bear more fruits on this metaverse platform. But the Korean government is willing to keep supporting this field. So I think we will have positive results. So based on our various content, we will innovate this digital world, and we are keep putting our efforts on this. Next slide, please. So by using this metaverse platform, we will diversify those different digital technologies, and in the long term, we will provide services to overseas patients or open branches overseas as well. So we will keep working on this till 2028. So next slide. Thank you. Thank you, ladies and gentlemen. A big hand to the presenter. Thank you. So it was session one's first presentation. Thank you, Professor. Next, we'll move on to a discussion session. So, Professor, please stay seated. And we will also have CEO of New Base, Sun Park. Ladies and gentlemen, please welcome her. So please be seated. So when you're ready, please begin.
네, 교수님
Professor Lee, I think I was very touched and impressed to be able to see what you are using, what you are doing by using the metaverse technologies. And I have one question. In the past, there was no particular department or team, I'm sure, that was in charge of metaverse. So were there any operating challenges? Well, we had Halim burned department or foundation, and you need to provide some sort of support to patients, and it can't just stay within the realm of medicine or medical therapy. So we have been providing social support and healthcare support to these patients, and we already had built some know-how and experience and expertise. And when it was about to stop, but because of the pandemic, we transitioned this program using the metaverse space. And as you mentioned, and as I mentioned, because they have been working and living with burnt patients, they had remaining the relationship, a very positive and close relationship with patients as well. That is why I believe that we were able to garner great support, and we were able to create a TF team, task force team, and then we also have Burn, a department who's operating the metaverse programs as well. Yes, and also you mentioned that there are communities using GatherTown, and there was also a case where D2 as well to encourage communication between patients and medical workers. Is there any reason why you went for two different platforms? I think D2 Land, which is 3D based, it's more of a real or true metaverse like space. But if you understand how patients' parents are, like they're used to Zoom, they can do this, but 3D avatar interaction is somewhat unfamiliar, too foreign to these patients. And because the D2 Land is a 3D, three-dimensional visual platform, um, Gather Town is based on 2D on the other hand. So as a transitional phase, I think operationally it was much easier so that people with low specification devices can also join. And when you play games and run programs, 2D Gather Town has a clear limitation. So I think ultimately when our patients are used to Metaverse, we can eventually move towards a three-dimensional platform, and our officials and employees can maybe create a program at D2 Land so that we can further utilize other opportunities. Okay, then, so get together 2D D2 Land. Was there any differentiated, more immersive programs that you have run before? Well, if you think about games or the meeting or touch point itself, contact point itself, in what space and what object or person you're going to encounter, that'll generate different behaviors. So if you move around in a 3D space versus a 2D space, it's very different. It's a very different experience and environment. So that's definitely different and differentiated. So let's say you want a real and truly immersive environment, then I think you should definitely go for the 3D platform. For more diverse environment or experiences, you think 3D is better. Yes, 2D is very limited. All you can do is just true or false questions, maybe. That's the only game option. Okay, I feel like your hospital is becoming very creative, and I think having a metaverse focused or oriented department and service providing organization or department, I feel like they will be very different. Metaverse will focus on innovation, on new challenges, and facilitation on community talks or dialogues. Do you have any know-how for operation? Well, building up a metaverse community, there are many positive impacts or effects that we can expect. And I think development comes first. And we need to delve and dive into this area. There's no limit on when it comes to time or space, so it's very interesting. And what's different from Zoom is that there are people who are okay with opening up themselves. There are people who want to hide and just be quiet. Some people would like to avoid difficult environments. So I think this is something you can fully utilize metaverse. You can set the range of information that you want to disclose to other people. So it's one great benefit. And so this is more encouraged and available in non-contact environment. So we can say that even when you are holding an offline event, if you're holding a metaverse event, I feel like there are more participants sometimes because they don't want to expose their participation or attendance to other people. So I believe that this is a clear benefit from that comes from utilizing metaverse and this space. Something we need to think about is how we can better utilize it. I'm sorry I'm asking you too many questions, but when you are meeting offline, what do you think are your patients, burn patients, think about metaverse program versus offline programs? As I shared earlier, because there's no limit in terms of space, so for example, you have to spend 4 hours to go from A to B, whereas you might have to suffer other people's stare, or you have to be exposed to the sun, but that is something you can avoid by using the metaverse platform. But also, meeting offline and talking to people in person is a benefit too. So in the past, there was only one option, which was metaverse. But now the pandemic is over. When you are doing both offline and online, I'm not quite sure how we can balance this or what a preference our patients are going to have. But this is our homework. I'm also curious. Yes, this is something that I'm curious about. By utilizing metaverse platforms, I believe that there are so many things that are going on in your mind. What are your plans? What would you like to do using metaverse? Well, what is available by using metaverse is by you understand the world by using your senses and also recognition, and metaverse is something that enables that experience or process. Real world is quite complicated. It's hard to predict, but in the metaverse space, it's much easier and more comfortable because you can control those elements. And in real world, there is a limitation because of your disability, but in this world, there's nothing that impairs you. There's nothing that is holding back. So when people are treated in hospital, they tend to have difficulties, making relationship with other people with no disability. But in the metaverse world, there's no such distinction between people with a disability or without disability. So without having this fear, they can try to connect with other people and make relationships with other people. So this is a benefit, and this is something that is on my mind. Thank you.
이렇게 해서
So that was the first discussion session of session one. So, ladies and gentlemen, please, another big hand to the two. Thank you. You may go back to your seats. So the first session are responses to metaverse and biohealth. Professor Lee shared the metaverse hospital's story and the operation case of Halim Medical Center. And the metaverse platform is currently fostering this environment to train medical professionals. So the new base and Halim Medical Center meeting each other was very meaningful. So then we'll move on to company presentations. The first one is Sun Young Park, CEO of New Base. Ladies and gentlemen, please welcome her with a big hand. Good to see you all. Just like I got introduced, we are a medical metaverse-based innovation platform. I would like to share what kind of projects we're working on. So let's begin. First of all, we work on digital technology to work on medical practicing, which is free from legal constraints or other regulations. So in medical sector, nowadays we're propelling our medical technology, and with SNU's hospital and Severance, Yonsei Severance hospitals, there are many challenges, and we're solving those issues. However, nowadays the earliest field that adopted this was where those clinical trials aren't needed. That is what a lot of people's expectations and projections. So after the COVID circumstances, the medical education field, people say that we have jumped this field 10 years forward. Like when training medical professionals, the medical national exams have changed, and nurses actual training sessions have changed a lot. So there were a lot of changes. So in the past, a lot of medical professionals had to get 1,000 hours of medical training so that they could get a certificate license. But nowadays, instead of going to school, you can just go to schools and conduct VR simulators to replace them. And also, medical students and other medical licensing certificates, those tests are now computer based. So instead of hard copy paper-based tests. They can use computers to conduct tests, so they can interact with each other to test them. So this global solution is showing 14% of growth rate. So then is medical education's challenges. A lot of hospitals are paying a lot of attention here. So based on those clinical training, it's the best to conduct tests on real patients. However, there are privacy issues, so it's very sensitive. So in the past, they used mannequins to conduct their training, but there are limitations to monitor actual their diseases, and there was no interaction. But nowadays, the technology has rapidly increased, so we thought, why don't we use this simulator to change this education field? However, despite the efforts, there weren't many existing programs in the past. That's why many hospitals were saying. So, what differences do we have? Is that first, the medical staff have a lot of patient cases. A specialist say that he or she would learn 1 or 2 dozen of thousands of cases. And when we built this game characters, in order to do so, there needs a lot of time to visualize all the different patients. So we thought, isn't there a way to realize this in a easier way? So we characterized this, and we have this auto mapping technology. So on the left, you can see that if you can input the physical input data, then according to the weight, the patient could be slender or fat. Or if you input age, then you can see a patient become young or old, and other input data. So if you input accident information, the severity of the injury, if you input that kind of data, then you can see an injury or wound on the body. So as you can see, so it looks like this patient looks like a zombie because even if he is injured, it doesn't look like hurt. So we also worked on neuro system. So if you input like the pain data or consciousness, and if the point is level 3 or level 4, so the patient would show painful reactions among others. So based on this, we databased this so that the system can automatically create patients accordingly. Next, you can't just conduct education just with this patient, so we have to diagnose patients and monitor. So we created this medical clinical skill game, and we modified this mini game. So if you conduct IV to this patient or inject a certain medicine or among other, so you can monitor, run diagnosis, and when you inject medicine, you can see the physical reaction from this status. So you monitor this and conduct actual experience. Next is how to increase the result of this. So through the results, you can see various interaction and accumulate academic data. So based on this data, you can refer to this medical guideline, and based on this guideline, we compare different factors and assess evaluation and provide that. And based on this results report, those students can think about what should have been improved. So when actually those trainees conducted this, when they reach 60 points, which is pass or fail, so many medical trainees kept training this so that they can reach 100 points out of 100. So has a good positive effect because they can keep training. So, in terms of realistic experience, how realistic should it be? So, people would think that it's realistic when patients look real. However, medical staff would say that medical responses should be realistic. So, this is an overseas case where they filmed an actor here. However, this actor is actually not a patient. So, it's difficult to see those wounded areas, and their eyeballs are also just like other ordinary people, not injured people. So it does not identify with identical with patients. So the actual outer appearance is a problem. However, medical people would say that it should be possible to inspect, osculate, and palpate patients. So if someone is like over breathing, then we input this data so that their chest is moving. So every like single factor was identical based on our program, so that medical staff can actually practice this. So which should be very close to our real medical practice. So we have this special differentiate characteristics. Next is the difference in playing method. So if you take a look at those conventional simulators, there are so many simulators, and they are based on click and done method. If you inject IV to a patient, then you choose an IV and choose a medicine, so you can administer that. But our model on U-base is very close to clinical trials. So you can see all the medical devices, and you can click and use all the different tools. So you can actually see this IV, and you can see blood vessels popping up. So it looks really real. So far, there's a Medibase platform where you can continue practicing from this model. And next is NurseBase, where you can go to a virtual hospital and treat a patient from hospitalization to getting discharged, thanks to this application. So NurseBase, we are providing this for free for COVID-19 patients, and at our Metaverse exhibition hall. If you visit there, you can experience this VR version for free. The VR version, we launched this platform in January, and the mobile version was also launched recently, and not only at Yonsei Severance University, but Severance Hospital, but also National Hospital of Korea is also adopting this, and firefighting headquarters is also using this platform to evaluate their fighters. And also the satisfactory level is really high. They said 99.7% said they were helpful, and they knew that it was a game, but still they said it was so realistic that they could practice this in a very helpful way. So I'll show you a play video. Please play the video. Does it not play? Well, if it doesn't work, then I'll just move on. Currently, I've been engaged in the healthcare user experience field and our company. We have medical specialists from National Medical Center, and also a game designer from Nexon, the online game company. And our team also has a lot of game developers and medical staff who play this game to keep working on this product. And there are many MDs from hospitals or partners with us, so we collaborate with those professionals to develop this game. So this digital stimulation education training is something more than those conventional training. But it's not just replacing it, but it's like continuous training of those conventional training. But our ultimate goal is to let them keep training and training, and that so many people can access this medical information. So we want to build this metaverse platform where we can protect privacy of patients. And there are a lot of disparities in this medical field, but we would like to let those developing nations to access developed nation level medical services. So ultimately, we would like to foster an environment where people don't have to worry about legal constraints or medical constraints. Thank you. Thank you, ladies and gentlemen. A big hand, please. New base metaverse. She shared it, and she also shared the vision of new base. Well, then we'll move on to the second presentation. Is M2S CEO Itewi. Please welcome Itewi to the stadium. Thank you.
안녕하십니까.
Hello, ladies and gentlemen. My name is Iteo. I am leading M2S. I'm the CEO, and I would like to briefly introduce our company to all of you. What do you think is the most important sensing organization in our body? I would say it's our eyes. Eyes are a good indicator of different diseases, the response of your eye, or how your eyes move. By looking and detecting these different moves of the eyes, you'll be able to see ophthalmologic or ENT or neuroscientific diseases as well. And I would say that VR and AR are going to become and serve as a new type of mobile in the metaverse era. And I believe that these types of new devices are going to be able to diagnose new diseases and as well as monitor the diseases as well. And relevant programs are to be developed. So, as a result, M2S has been applying XR technologies in the medical industry, and we are developing something that does not exist in the world at this moment. VR's immersiveness can increase the conformity of diagnosis and treatment, and thanks to the technological prowess of M2S, we can detect and diagnose ophthalmologic or neuroscience diseases, and we can also develop and make new algorithms for diagnosis and treatment as well. Let me introduce our first product called VROR, Virtual Reality Ophthalmic Room. And first and foremost, I would like to introduce VROR 7 in 1. This is a comprehensive ophthalmology medical device that can diagnose and detect 7 different elements for your vision and eye related diseases. We were registered as number 1 grade medical device at FDA, and we also applied for medical device approval at the KCDC, and we are now going through later level clinical studies on top of the initial studies that we have accomplished by last year. And this device is going to be not just used in Korea, but has garnered contingent from overseas customers and clients. It's not just diagnosing the status. Based on the data that gathered, you provide treatment advices or healthcare advices, and you can also integrate mobile and web-based interfaces altogether. You can see the recommended and committed healthcare supplements for intake as well. So it is a total wellness program and platform. As I mentioned earlier, we do not stop just at ophthalmic diagnosis. We are moving further into the other areas such as nausea or headache or neuron diagnosis or tests as well. And we're going to combine all this as one comprehensive test in the future. And the second product we developed is called ND150 Neurodiagnostic Instrument. And this is a device, a VR neurodiagnosis instrument, which is not invasive, which is for the first time in the world. We will be able to diagnose the localization, the location of diseases in your brains by indicating and calculating the movements of your eyes that are abnormal. We we are already registered under FDA last year, and we also registered as a medical device and got approval from KFDA as well. So you can see that we are now developing VR ophthalmic diagnosis device and VR neurodiagnostic instrument using VR technologies. We are going to create a new content for ophthalmic exercise. We are also going to focus on neuro diseases and rehabilitation programs as well. In addition, we are building digital healthcare product lineup as well so that we can expand into the area of metaverse platforms. We will also provide medical related trainings, and in collaboration with Korean Medical Center, we are now running practical training programs in the metaverse space, and we are currently developing additional medical wings such as respiratory or neuroscience. And we will also expand into XR healthcare platform so that all users will be able to benefit from our technologies. And we will also build Metaverse Healthcare Clinic, and let me show you what we are doing at the moment. So currently, as the start of the Metaverse platform, we're building a Metaverse human, AI human. So we're not going to stop just at providing relevant information or data. We want deep intervention and invasion and engagement. We are done with the prototype making, so we will make this character learn all the medical information so that she can come in and involve in the healthcare services, including the info desk person. But to a doctor, we are going to utilize fully in all areas and walks of digital healthcare. So, starting from step 1, which is XR diagnosis solution, we will move on to step 2, which is digital cure solution. And step 3, ultimately, we are going to build a healthcare platform and metaverse and become a global XR healthcare company. Our company received innovation awards last year at CES in healthcare and wellness, and we also were awarded in SIGGRAPH. We were the only company that was invited from Korea in 2019, and we were awarded with many different design awards such as Red Dot or TIPS as well. So, as you can see from my presentation, we're going to combine XR and augmented reality with medical therapy to create new values. Thank you, and we would like to ask for your continued support. Yes, the second presentation is over. Thank you very much for your presentation. Moving on from digital transformation, you are becoming a global metaverse platform. CEO Lee, thank you very much for your presentation. Let me move on.
세션 세 번째 발
The third presentation will be Hyuino, CEO Kim Young-jun. Please welcome him to the stage. Good to see you all. I'm Kim Young-jun from Hyuino. Huino is concentrating on ECG technology, and we have completed developing it, and we're putting all our efforts to access the market. So usually we finished the patent right. So now we will launch our business, our product in 1 or 2 weeks. So I briefly tell you about the market. When it comes to ischemic heart disease, the ischemic heart disease account for number one for the world death rate, and followed by stroke or pulmonary disease. And if you only classify this a chronic heart disease, then it accounts for number one, which is categorized into hypertension, arrhythmia, heart failure, heart valve problems, or arteriosclerosis. And number one, hypertension, and number two, arrhythmia, they too account for 90% of all the heart diseases. And among them, we're currently targeting on arrhythmia. And among arrhythmia, as you can see from the statistics, the arterial fibrillation account for more than a third. And the arterial fibrillation also has a very high rate, and it has a notorious name, the silent killer. So it can lead you to stroke or a sudden cardiac death. That is because of the fibrillation, there is blood vessel issue, which blocks your lungs or your blood veins, which can occur very risky diseases. The highest risk is that you don't have any symptom. So people can't feel this, but suddenly your lungs or blood vessels will get blocked, which leads to a high chance of death. Currently, when you come up with diagnostic solutions, there would be inpatient or ECG, but if you fail to monitor it, then you conduct Holter test, where you attach these patches on your chest and wait for 24 hours, like living your ordinary life, and monitor the ECG, and then you return the medical device to the hospital. Then they analyze the 24 hours of your activity. So that is the Holter test. So it only spans 24 hours. So from the clinical patient's perspective, it's relatively short. But you never know when the arrhythmia or other symptoms would occur. So most of the patients, even if they do have this disease, the Holter test might not successfully monitor it. So when you conduct this Holter test twice or 3 times, there is still a chance where they fail to monitor your disease. But if the symptoms continue, then you can choose invasive loop coat with the device. This is an invasive ECG test you inject in your body, and you monitor ECG for a long term. So that has a limitation. When you take a look at the relative market, there is 12 lead ECG, exercise impact ECG, Holter ECG, event monitor ECG, and data analysis. So there are 5 different categories, and Huino is specifically targeting on Holter, event monitoring, and ECG data analysis and diagnosis. Next is Huino's technology. So we aim to go beyond the Holter ECG monitor. Like I said, arrhythmia itself is hard to monitor. You would just cough or sneeze, but you never know when this will occur. So we have to monitor for a long term. So that is the most significant factor. So if you take a look at the bodies of previous research, if you keep monitoring, the chance of monitoring a patient is 42%. when monitored for 1 or 2 days. But if you monitor for 14 days, then you can detect the disease with over 99% of chance, according to studies. In the US market, based on this, they say at least 14 days of continuous monitoring is recommended. And according to the standard guideline, they also have this 14 days rule. So when you have big data, the biggest burden is that when the number of days of monitoring gets big, then the data's volume is really high. So you need a lot of expenses and time consumed to monitor this. So when it comes to 24 hours at Seoul National University, in order to monitor a Holter for 24 hours, you have to wait for about 18 weeks or so. If you translate this into months, then you have to wait for 5 months to conduct a 24-hour monitoring. That is because 24 hours of continued monitoring is like 2,880 pages of A4 paper when you like so transcribe this monitor data. Then they have to process this data, and medical staff have to process this. So processing this takes about 1 or 2 hours to analyze this data. So at least 5 staff members or up to 9 medical staff members have to work on this analyzing. But if it comes to 20 or 25 patients, only 20 to 25 patients can be processed. However, every day, like about 500 patients come here, so it's really hard to process this. But if you make use of this our solution, then you can cut down the waiting time and you can increase the efficiency. And like I said, by continuously monitoring this, you can increase the detection rate by 4 or 5 fold, and you can preemptively detect your disease. So this strength itself has a very significant meaning that patients who have a potential to have a stroke, but they can prevent this from preemptive monitoring. Now I'll move on to our product line. The first in Korea to get approval from Ministry of Food and Drug Safety, and the first to get the medical covered reimbursement of health insurance and wearable device. And last year, we ranked #1 in the global wearable device contest. We finished the funding, and we have accumulated investment of $80 million. And we have partnership with Yuhan Corporation, KDB Industrial Investment Bank, and NH Investment and Securities. So the NH Securities is working as our broker on this investment. So this is the first wearable medical device in Korea. So we have this history and experience. So all our medical devices, where we have listed them in medically covered by medical insurance, and the first of its kind in Korea, we came up with this medical compensation. So in the past, the medical expenses, the medical coverage was 50,000 won, but we increased it by 200,000 Korean won. So this has been working from January this year, 2022. And we make use of KakaoTalk chatbot, which is the first of its kind in Korea. We synchronized this chatting bot with patients. If patients leave microdata, then the AI robot can provide information. You can interchange data remotely. So patients provide information and the medical staff receive data, and they can make a phone call to make a reservation. Back in 2019, we were designated #1 regulatory sandbox company. So we are free from medical regulations thanks to our service model. So any business entity can use this thanks to this documentation. Last year, there was PhysioNet 2021. We participated in a contest where what kind of neuro system does the best monitoring, and it was sponsored by Google. And 12 led ECG, and 3 led and 2 lead, among others. There were 5 different categories, and Huino won in 6 led and 4 led. Huino won the first prize, and for 12 led and 3 led and 4 led, we won the second place in 12 led and 3 led and 2 led. So we have proved that our competitive power is high in the global level, and we are working hard to go public. And as I mentioned, in the end of this year or early next year, we're planning to go IPO, and then we will join the co-stock market soon. This is our team. We are equipped with the best personnel in the fields. I personally have a PhD in computer engineering, and my second concentration is HCI, human-computer interaction. Based on micro technology, you can process this data at my lab. So I've been conducting this research for 2 decades, and there are other specialists as CTO, CSO, CPO. And here is the Science Advisory Board. The top 5 medical hospitals in Korea, among other specialists, are members here. And we have a very clear proposition. Patients can preemptively monitor and detect their disease. And for heart diseases, they have 5 times of higher risk of getting a stroke. So we would like to provide a better opportunity for them to monitor them. And for medical staff, they can monitor up to 20 to 25 patients a day in the past, but they can increase the number to 100. So their productivity, their efficiency will increase by a huge gap. So if they can prevent, monitor, and other heart diseases, then we will have significant benefits. So that is why we successfully got these devices included in a medical insurance list. So we're a leading company in this field, and in the future, we will work on remote monitoring and home clinic, among others, so that remote medical services can be possible in the future, and our company, Huino, will put efforts to bear fruits in this field. So that is the end of my IR. Thank you for listening. Thank you. The third presentation was Huino CEO Kil Young-chun. The digital transition, the leading company of DX. I would like to urge you to pay a lot of attention to this company. So our response is to bio, healthcare, and a metaverse. And that was the end of presentations and discussion session. So from now on, we will have a short break. It's around 2:40 p.m. And after a short break, we will have about 40 minutes of break. Then we'll move on to session 2. Those participants watching online, you may also have a coffee break, and please join us again at 3:20. And please enjoy your break. Thank you.
문화재의 길을 걷던
잠시 후 3시 20분부터 세션
At 3:20, session 2 will begin. For those who are joining for the next session, please make your way into the venue and be seated.
감사드리겠습니다. 네, 아울러 지금 현장에 계신
And also, there are offline participants here, so I would like to ask for something. Currently, there are a lot of empty seats at the front. So, if you would like to move to the front seats, then I would appreciate it. And also, the IR materials will be uploaded on the official website, so you can take a look at them afterwards. But nobody is actually moving to the front seats. So at least a few, please move to the front seats so you can take a closer look to the materials.
네, 여러분 편안한 휴식 시간 되셨?
Ladies and gentlemen, did you enjoy a good break? Currently, there are a lot of empty seats at the front. So if you would like to take a closer look to the presentation, then you can feel free to move to the front seats. So a lot of people were able to share their business cards and have some free discussion during the coffee break time. So this is a good opportunity for you to share your ideas. Well then, let's begin the second session, session 2, under the theme of Metaverse Response. And let's begin the second session with the theme presentation, Metaverse, a strategy for Metaverse and Biohealth 2. Now, please welcome Dr. Im Jun-suk from Yonsei University Health System. Ladies and gentlemen, please welcome him.
Hello, everyone. I'm in charge of digital health at Yonsei Medical Center. Thank you for the invitation. I'm sure that you might not be quite familiar with digital health and digital health response, but we decided to use this name to reflect that our strategy and our vision going forward is going to focus on digital transformation. I am a radiologist, and as you can see from the slide, what I would like to touch upon today is going to be the meaning of digital health. Of course, I'm not the main representative of the medical system itself, but as a person who work at a large university level hospital, what we are thinking in terms of digital health. So I think there could be many different terminologies that could be used to describe digital health. But I think my favorite term is basically the use of ICT in support of health and health related fields. It's quite clear. And I would say that the statement was made and clarified at the WHO World Health Organization statement back in 2019. And you can see that it starts with AI and ends with telemedicine. Now moving on to health definition. When you say someone is healthy, that means it's the absence of disease or infirmity. That was a definition created by the WHO, World Health Organization. But you can see that there was a change back in 1948. It says being health is the state of complete physical and mental and social well-being. You can see it is encapsulating more of a broad and comprehensive status of a human body and being. So health is basically to support the state of complete physical, mental, and social well-being. I think this is a very accurate way of depicting the status of health. And I think digital health care is something that is more frequently used compared to digital health. But when you say health care, there is an agency that provides the care. So when you say you're giving health care, then there is a recipient. I think this is a very passive use of the term. So I believe that digital health is more inclusive. It is a terminology that addresses more stakeholders and players who are in the health care industry. And I believe that since the advancement of human civilization, there were a major 10 medical advancements. And I think number one would be a vaccine, and then also the invention of anesthetics, germ theory, medical imaging, antibiotics, and organ transplants, antiviral drugs. There are first 9 things. And I would say the last puzzle of this 10 medical advancements would be AI or digital health. That would be maybe the last 10 keyword to the top 10 medical advancements. AI could be included in the term or a concept of digital health. So if you go to very detailed corners of this area, if you think from a perception of digital health, I think if you are going to think about a certain future, you can say that some people say something's going to go first and something's going to follow. What matters is who or which technology is going to be adopted first and which technologies are going to be adopted late. So, um, because I don't have the right to um, talk about what's going to happen in the future, what researchers tend to do is go back to and refer to relevant reference points or literature. So I would like to talk about the digital healthcare service industry nurturing strategies created by the Korean government, the central government, and you can see some interesting keywords that are mentioned in this report. Number one is I think the government is focusing on a due diligence, like verification process, whether it's valid or effective or commercializable. And also, I think digital treating device is being emphasized, and support device for artificial intelligence diagnosis is mentioned as well. Mobility based remote healthcare service is mentioned. And if you look at some other areas, you can see that mobility will be connected through the 5G technology as well. I think how I interpret this is that the government is now assuming the use of remote and tele Medicare when they are planning for or trying to adopt different policies in the medical industry. You can see that digital health related software, if you can divide them into two different types, I think this distinction is quite important because if it's a non-medical device, it is very easy to avoid regulations. Whereas if it's a medical device, then there is a sanction up front. But once you pass that barrier, then because there's the interior barrier to protect your own device, you will have a better advantage or ground for your use or commercialization as well. So when it comes to medical devices, these are going to be used for diagnosing or treating a certain disease. SAMD would be AI-related solutions, digital treatment, VR, AR, metaverse solutions are included. For non-medical devices, it is to collect health data and to record lifestyle as well. So for due diligence process, I would say there were two different hurdles. Number one is KFDA hurdle, and the second element would be being eligible for national health insurance. So getting KFDA approval, that means you can release or launch your product into the market. That means you can use it for human body. It's stable and safe enough, and you can also sell it. But that doesn't mean that it is valuable enough to be used for a patient. There's no proof that it is going to be actually curing or treating a disease. If it's approved that way, then it'll be registered as a standard of care, which is a totally different approach or level. And if you look at the image on the bottom of the slide, there is continuous blood sugar measure that was launched back in 1999. This was approved by FDA, and it was now covered back in 2020. This means that it took almost 20 years to pass that verification or due diligence process. So you might think that, oh, medical officials are so conservative. Why don't they just adopt it more quickly? Why does it have to take 20 years to make sure that it's used? I don't think it's good or bad. I think engineers and physicians have a different grammar to understand the use of different technologies. So, for example, for lung cancer, This is number one killer of humans, and this also has the number one morbidity as well among all cancers. So, for just simple chest PA, no one says we need to just use the simple imaging, because by doing it, we won't be able to early diagnose the cancer. So as a result, there is low dose CT on the right side of the right image. You can spot a lesion that's quite small, and we can't really use chest CT as the main indicator because of the dose of radioactive materials. And by using and adopting low dose CT, we were able to avoid many misfoundings of lung cancer. And because contrast itself is quite good for lung cancer, we don't need to do any additional IV treatment as well. And physicians decided to adopt this low dose CT as the standard of care for diagnosing lung cancer. But you can't be that simple, because there is a concept called lead time bias. So from the appearance of symptoms to death, even if you early diagnose lung cancer, you can see it might seem that the survival period itself is growing because you detect it early, but if you actually calculate the time between symptoms and death, even if you do and apply the same regimen or same care, the survival rate doesn't change. There are some lead time bias that we have to overcome. So once we overcome the lead time bias, we can use it as a corporate or group usage of a specific device, and that is why it takes such a long time. So I think maybe Korea is number two in the world. This low dose CT was included in 2019. So if you look at other cancers, you will get diagnosed after like 40 or 50 or something like that. But for lung cancer, there's a quite specific criteria. So it has to be over 54 and under 74. And there's also a specific criterion. If you have ever smoked before, then it's considered a important risk factor. Let's say you smoked a pack of cigarettes every day for 30 years, then low dose CT cancer screening is going to be conducted as well. And I think this is a report made last year. And whether we do low dose CT, the impact is going to be valid or not. The report says, oh, it is valuable, it is remarkable, meaningful. Some reports say, oh, there's not quite a clear benefit from doing that. So there's still debate in the industry. So software as a medical device, this concept can be addressed in four different areas. This is different from conventional healthcare medical devices. Of course, software as a medical device is not harmful to human bodies, and a medical device has to be composed of software without hardware. It has to be an overlapping area between digital health and medical device. And also, software can be updated multiple times a day. But if you think about how medical devices work, even for a small and minor update, you have to get an approval every time you make an update. But for software, you can't really do that. You can't run it that way. So FDA decided to adopt the free pre-cert methodology. So basically, FDA will give an approval to a company rather than a specific device or the version of a device. So I believe that medical AI or digital cures and treatments belong to SAMD. And these are the verification protocols that you have to utilize and follow. It says valid clinical association. What does that mean? Let's say NICU death rate is predicted, and there's an AI solution to prevent as much death as possible. And I think you have to understand if pastors are coming more frequently, then the death rate increases. Of course, it could be true, but I don't think there is a medical correlation between the or clinical correlation between the visit of pastors and a death. So we have to make sure that input data is correctly put in, and you also have to look at analytical validation and clinical validation data points as well. One is missing here from the slide. So I think ultimately what matters is clinical utilization, whether the adoption of a device is improving clinical utility of a patient. Clinical utility is probably maybe the coverage of national health insurance. And moving on to digital cures, I think this is a hot topic in the industry as of now. Um, this is, uh, let's say, probably a new treatment which will get an approval from the national insurance coverage. I believe it's going to be probably a digital cure. The reason why I'm saying this is because workload management or efficiency management is what we have been focusing on in a software concept, but digital cure is more of prescription based. So it's quite interesting. You can see some of the examples, such as Reset, which is a drug abuse or drug addiction treatment, and Somris, which is insomnia treatment. And another axis of SAMD would be clinical evaluation. You can see that at FDA, AI oriented medical devices show that 61% are related to radio or radio image devices. So you can see that 61% of FDI approved AI medical devices are focusing on imaging technologies, and 18% would be improving the quality of image or video. And the pain point of radio imaging is that it takes a long time for analysis. And if you cut the time, then the quality or resolution of the image drops. So I think AI-based digital devices are trying to resolve that specific issue. And if you think about remote telemedicine care, it was difficult so far because of the legal limitation in Korea. But by adopting telemedicine, we can cut the time and we can prevent the waste of time quite significantly. So there's a clear benefit. But the problem is that there's lack of evidence, and also using the end-to-end full range information utilization. And now I would like to move on to the area of digital health business. You have to look at why people succeed or why people fail. Of course, number one reason is running out of cash and fail to raise new capital. This is obvious. And if you look at a specific article about AI technology being used to early detect pancreatic cancer, you can see that the title of this article says Joint Study for Early Detecting Pancreatic Cancer Using AI Technologies. CT imaging will help contribute detecting pancreatic cancer without giving IV injection. There are so many fancy words included in the literature, but would you pay for this? Would patients pay for this? From medical perspective, as I mentioned earlier, CT would. Do you think this is a reasonable or legitimate way of detecting a cancer? Don't you think there will be more constant pros? And do you think early detecting pancreatic cancer will also improve the outcome of a patient? That's debatable because pancreatic cancer, because it advances so quickly, many physicians agree that early detection won't really matter. So technology's perspective, it's quite viable, but whether this is going to be commercialized or not, whether it's going to be commercially successful or not, there's a clear debate between physicians. And this is actually a successful example. If there are many people who are doing J-burn a lot, then there is a J-burn prediction model. You can see that 50% is decreased due to the establishment of the model, and a failure's case would be 0. This is to provide quantitative information related to sleeping. You can see that all you provide is how good of a sleep you had, but after that, what are you going to do using the information? There's lack of process afterwards. Sorry, let me. I think I'll jump to my last slide. Sorry, I've been blabbing too much. You can see that there are big trees and also small and thin trees on the left side. Unfortunately, the digital health I know is closer to the left side. There are minor and small specific technologies that are springing up, unlike a big tree with a big root. So, from startups or small companies, the left environment is much favorable to them. Thank you very much.
시작.
It was Professor Lim. Then we'll move on to the discussion session. We will welcome Professor Lim again to the stadium, and also we will welcome a questioner. Is CEO Seok-Won from Neuro Ears. Ladies and gentlemen, please welcome them with a big hand. From now on, we will begin the discussion session. Well, first of all, thank you for sharing the digital healthcare's trend and your thoughts. And I myself, being a CEO of a company, and I myself as a professor at a university, I had my personal feelings of listening to your presentation. So I would like to ask, you presented about digital healthcare, and my company's product is, like you said, we are focusing on SNAD, but without a hardware. So when I conducted my business, the most difficult part was licensing. So in April this year, we got the final licensing, but during the process, there were a lot of not understandable issues. So I, of course, preemptively needed a GMP licensing, but we are software based. But they asked us if we have a manufacturing facility or not. But we only have the software computer-based technology, but they required us a physical space to get licensing. And when we worked on this licensing procedure, of course we are software-based, so we thought we wanted to make an e-purchase on website, and the fee of downloading it, we wanted to make it free for downloading. However, during the KFDA's regulation, they said if you want to get licensed and if people download it, you can't sell it with a disk, flash disk. You'll have to get licensing for that separately. So in Korea, they're trying to drive this. However, we need innovation and deregulate in this sense. So for software-oriented companies, the government level should deregulate this issue, like making mandatory for hardware. So, but we're currently Korea is lagging behind on this sense. So, shouldn't we deregulate this at the government level or the university level? What are your thoughts on this? So I'm okay. Sorry, the microphone is off. So I leading the digital health department. Each department's professor request various services, and if I listen to them, cloud or other outside resources. They make use and process patients' data. So that is the most common field. So they want to open a network on the digital health sector, and we monitor and review their requests. Well, opening a network itself is probably would belong to the hospital policy, but there is personal security issue, privacy issue. So we should take a look at if there is any security issue. And the way we process this is that outsourcing this privacy data. So there, I personally forgot the exact terminology, but when we use this and make use of cloud technology, then it's possible to move information back and forth. That was the answer that I got when I asked them. And whenever there's a change in this field, they have to change the entire model. So that's why a lot of people get confused at that stage. So when it comes to digital security or privacy, those people say that they have their reasonable and rational ideas, and they all have their personal individual thoughts. But it's difficult to say what is the best or what is right. But if there is a common platform that everyone can make use of, and if we sign this and approve this platform, and if the government approves licensing for them, then probably enterprises, businesses, and hospitals will feel less burden, I would say. Well, then, in that sense, if we build a platform regarding that, we still have this remote platform. So if we use Sandbox platform, we're currently working on it. But like you said, Professor, under this such platform, if remote medicine becomes possible, then would medical remote medicine be possible? Actually, well, this is my personal opinion. When it comes to remote medical service, well, instead of saying remote medicine, let's say medical remote medical services, because the wording itself is quite sensitive. But there are many people who are pro medical, remote medical services. Not only remote medical monitoring, but also the medical practicing itself. There needs a lot of factors to consider, and in terms of platforms, new government regulations, or there are a lot of demands. And what we learn at medical school is always considering benefits and risks. When you practice treatment, if that is the benefit is bigger than risk, then you conduct it. So I think the risks should be minimized, and you have to balance between the benefit and risk. And if there is more benefit in a specific field in medicine that has more benefits, then I would say that there needs no prohibition. Well, this has to do a lot of metaverse. So under only when we secure this security or safeness, then we will be able to use metaverse. What are your thoughts on this regard? Well, in terms of metaverse, well, I think the metaverse platform quickly being adapted to the medical education, I think that will be quick, but the medical procedures, then probably we need classifications in different fields. There are some platforms where it already adopts the model, so there are partially adapted. And when you consider the business perspective and expandability, instead of by installing it in each hospital, when they build a cloud platform to share, but at this point there are legal regulations, so it's not free to adopt all the demands. Well, I think that is the end of the discussion. Well, thank you. Thank you for the two gentlemen. Another big hand, ladies and gentlemen. So, by discussing And also mentioned the metaverse converging, and they also mentioned regulation and deregulation of metaverse. Thank you for your meaningful discussion session. Well then, from now on, we will move on to business presentation sessions. Next is Kakao Healthcare's CEO Hwang Hee. Please welcome Hwang Hee to the podium. Ladies and gentlemen, please welcome him with a big hand.
Hello, everyone. My name is Hwang Hee from Kakao Healthcare. Yes, I know that this is such a big event, and I'm glad that I'm invited and I'm here. But I don't think we're at the state yet to do IR at this moment. So today I'm going to introduce what company we are and what we are interested in as a company. That will be the purpose of today's presentation. As Director Lim shared in the earlier part of this session, digital healthcare has a huge range and coverage, and as a result, many startups focus on very specific areas. They plan their service and they focus on such services. That's the usual pathway that they have. But to be exact and to be more specific, all healthcare uh, services can be called digital healthcare if they're using digital technologies, and any preventive service from home to hospital or even after leaving the hospital when it becomes a chronic state or disease, it can be managed by digital healthcare technologies as well. It could include AI, cloud, data, mobile technology, or other service specific verticals as well, EMR, telemedicine, or a wide array of services can be included in digital healthcare. So, if you're going to be listed, then we were thinking what we are going to be best at. That has been discussed internally among our employees and officials, and this number includes a direct diagnosis or care as well. So you don't have to focus so much on the number specifically. But if you look at what happens around the world, the portion doesn't change, even if you include digital. So I would say half the size of the US and is coming from the US. A third is coming from the European region, and the third biggest region will be Western Pacific. I don't know where Korea belongs specifically. So I was thinking, do you think being number one in Korea is so meaningful? And if you think about how Korea is, we don't look at it from a medical industry perspective. We look at it from a welfare perspective, and regulations are focusing on that concept as well. So, of course, uh, being number one, being a leader in the Korean industry is difficult. But I also think at the same time, if you're not going to be a global leader, going through enduring time and doing research and development, maybe it's not so attractive. So as a result, we are planning in services that can penetrate into the global service or global market. And internal discussion had been going on. And despite all the challenges we have, I think I would like to share a market trend. This is the US data, but I don't think we are different from the US. Human resources are limited, and people are aging. And I think the number of outpatients are going to increase as a result. So, on one hand, in the past, people had to come in and had to be admitted to the hospital, but even as outpatient status, you can maintain the same quality of life. So, it is definitely a positive indication. But at the same time, because of limited resources, if you want to provide adequate level of medical services, you have to focus on outpatient. You have to reduce the number of inpatients and also readmission as well. That would be a very important and great performance index from hospitals. And if you think of it from a patient's perspective, let's say for a chronic disease patient per year, if someone has to be with you 365 days, and if you have to do something alone, then you go to hospital 4 times a year, you see doctor for 3 minutes, and if you think that only 12 minutes are provided to you, the rest would be covered, not covered, it's disconnected. You're separate from the hospital. But do you think patients are going to uh, have worse symptoms or worse situation? It depends on patient's location, income level, or knowledge level, expertise, or social class. So you can also think of it from a social class perspective. A patient's health outcome or improvement level is going to be determined by that patient's social class, even though medical service itself is already unequal, unequitable. So I think we need to think about the accountability and the inequality of medical services. How can we better provide, even though not 100% will be solved, but how can we reduce this barrier? How can we make sure that people get more attention and better care despite their income level or despite their low or social class? So I think the healthcare ministry and many different relevant organizations are providing resources. I don't think this is to increase an industry size itself. It is to make sure that we provide quality healthcare to people as they age, and when we are going to have limited resources. I think other countries are facing the same challenge. If you look at big tech companies like Amazon, Microsoft, Apple, Google, they all say healthcare is their future. And of course, there is slight difference in terms of directions, but there are the same commonality that they think it is important. As a platform company, even though many are coming from other platforms, you can see that active users are 200 million, 1.5 billion. All these large groups of users are secured by them, so they have a clear advantage, and they have confidence that they can provide quality healthcare services to a number of people. So, in that sense, if you look at the same lens or perspective, Kakao, the platform, it says itself has a more than 40 million daily user and also more than 50 million monthly user. I'm sure most of you, there would be no one who would not have been using Kakao Talk, Kakao Pay, or Kakao Taxi. I know some of you are against it or are offended by it for various reasons, but it's hard to find people who are detached from the Kakao platform itself. So Kakao has a clear advantage, and it is well positioned. But do you have to think that whether Kakao's platform strategy is going to be attractive to foreign users as well. So I think we have to have different two-tiered strategies in Korea and other countries. How narrow, how focused we're going to be, how pointy we're going to be. We will have two different strategies in Korea and outside Korea. So to look more specifically on overseas cases, you can see that Google is going to focus on AI-based healthcare services. And if you look at what Amazon is doing, because it started from retail to cloud computing, it's going to focus on telemedicine, which is endpoint service. And Microsoft, they're using existing Kinetics and Blizzard. And today's title is Metaverse, but Motion A, HoloLens plus Motion A plus Blizzard. If you think about the acquisition of such three companies, Microsoft now is equipped with all elements that are necessary for healthcare support and telemedicine. So it's worth of focusing and monitoring what Microsoft is going to do in the future. And it seems that Microsoft is trying to buy more sophisticated voice recognition services and technologies. And I think, yes, MS, this is something that's worth noting. And Apple, you know that they're focusing on wearable, which is Apple Watch. And I think all the ecosystem is springing out from Apple Watch, wearable devices. I don't know how fast they're going to develop their healthcare services. So among them, because Google wants to utilize AI for healthcare industry, what they are doing from industry's perspective, resources and lead time are important. It's not just about technologies. We have to think about investment, technology and financing and funding and all the other elements. So you can see that there is DeepMind from AlphaGo and next Pixel, WearOS, Google Cloud. You know all these companies and have heard of companies. They have the structure, and if you look at if you try to replace these different companies from Korea, if you, let's say, put Kakao on the top, and you can see some other differences. We are not doing hardware. So if you exclude hardware, there's logistics, infrastructure, AI, blockchain, NFT, all these healthcare related sectors are owned by Kakao as well. So, what Kakao Healthcare is going to do is to create a mobile healthcare services that are independent and deliver services. That is going to be our biggest homework. But number two, what's important next is, as I shared earlier, all the assets and entities are going to be coordinated by our group so that it can realize maximum impact when it comes to healthcare. That's going to be our second homework that we have to resolve and do. And among Kakao, we were thinking, what are we good at? What are we good at? Kakao, mobility, bank, pay. These are most loved services by our users. So I don't think we are good at something that's grandiose or huge or big or so fancy. I think what we're good at is something that's very simple, common, but we go very deep and resolve a challenge, a real challenge, and then users love it so much so that users stay in our platform and ecosystem. Commerce comes, ad comes. That's how we developed our services. So when we planned, we never thought, oh, we were going to do Kakao Talk and then develop it to these different branches or areas. So I think healthcare is the same. Everyone asks me, what would be the BM for Kakao Healthcare? I said, I don't know. What we are focusing on is how many patients, how many people, how many hospitals, how many startups can come in and join and stay in our space. That is our homework. That is what we're going to focus on. And I'm sure BM is going to come in and follow as we are good at those areas. So in that sense, I think we will address unmet needs. So, what are unmet needs? These are needs from patients and people, and I think our important client would be hospitals as well. Medical suppliers or players would be hospitals, and there should be no conflict with them as well. If you have a conflict with the main player, it's very unlikely to be successful. And we will also be able to engage startups as well. We have to understand what are pain points for hospital, what are pain points for startups, what are pain points for patients, and combine these pain points and provide a real solution. We can't really share our specific products or solutions, but in the big frame, we are going to focus on mobile-based all life cycle healthcare management. We call it virtual care. And the second element that we would like to focus on is data enabling. This is a collaborative work between hospitals and other medical stakeholders. So this is going to serve as a data backbone. So currently, all the data is staying inside in silo at hospitals, but to utilize healthcare data, there is a like a number of resources and time that you have to put in to be able to actually share the data with other organizations. So if we can serve as the middleman to share data, I believe the meaningful results are going to follow as well. So ultimately, what we would like to do is to realize the value of digital healthcare. It's going to take a while, but we will focus on prevention. We will focus on healthcare management. We will focus on prediction and alert and chronic disease patients management as well. But we're not going to touch the care or the treatment elements. I know that hospitals would like to see something or do something, but because of the limitation of resources, they can't quickly jump to those services, to providing the services. So we will be the data enabler. We're not saying we will be the doctor for you, for patients or people, but instead, by providing such services where hospital cannot do because of a limitation of resources, we will provide borderless services. Borderless is not talking about the borders between countries. It's about whether you have money, whether you do not have money, you will be equally accessible to quality healthcare services so that you can enjoy managing your own health. This is the vision we have going forward. So internally, we put the elements that we would like to do, and I think there are many different areas, quite challenging ones and quite stable and common ones. We have a large distribution of services that we can touch upon and delve into. So our future looks very dynamic. I think the reason or what makes us feel happy or have a sense of reward is that we will be able to contribute to have or build a playground for our people so that they can happily manage and control and monitor their own health. And when the reason why we say we are building a playground is because today we can't really talk about startups because of the lack of time, but as a mobile platform, I think in its essence, there are many different vertical services that can come on top of the ecosystem. So I don't think there will be one company that is going to do everything or dominate everything. That's just how it doesn't work that way. So in that layer, many different numerous startups are going to come in and build a structure to co-work and collaborate. And by structure, we can expose a service at once to you know millions and billions of people, and startups can also grow with us in that ecosystem. And I believe that the end benefiting patients as well as companies and hospitals will favor and like our playground that we're about to build as well. So once this reference is built in Korea, I think it'll take about 1 year or 2 year. When we first plan our service, we will always have a global penetration in mind in the long term, and then eventually we will engage in a global project and business. So when I was working at a hospital, when I say, "Oh, we will export to Saudi Arabia or other countries," I have always fulfilled my promise. So I believe that there will be foreign references and business results outside Korea. That is our hopeful scenario, and that is the picture we are depicting right now. So, as my last comment from my presentation, there is, of course, a clear advantage as a platform. Around Lunar New Year holidays, when Omicron was mentioned in other countries, and when I was sitting in the office, we knew that the surge is going to come into Korea, and I thought that tens of thousands of people had to be diagnosed and would have to take tests, and many of them will probably have to monitor their own health in the house because, calling them regularly will have a clear limitation. So as a result, we decided to create some content utilizing Kakao's technology and hospitals. We were able to create an open chat as well, and then they said, okay, let's do this project, and we launched the service within a week. But as expected, unfortunately, 500,000 of patients had to get screened and tested for COVID. And even though we temporarily posted as an ad, within 3 days, 100K subscribed to the service. So you can say that a third of all patients used Kakao service. You know, no matter how good of a service you create, even if you expose it so well, it's really hard to collect 1,000 to 3,000 users at once. But even though Kakao is powerful, or if it was, the exposure level is high, I was convinced that it could be exponential, and it could actually reach out to many different audience in a quick manner. I think this is the essence of Kakao. This is the reason why I exist. And I believe that by doing this, we can create a better world where technology and human meets. Thank you very much for your attention today.
기업 발
Thank you. The first presentation of session 2 was by CEO of Kakao Healthcare, Hwang Hee. Our mutual goal to provide value of healthcare. So this is a mutual prosperity of the leading healthcare company and other as small and medium-sized companies. Next, let's move on to the second presentation of session 2, which is LN Robotics by CEO Choi Jae-sun. Please welcome him to the stage. So this is our robot, and there are. It feels like I am a kid who are like showing my toy around to other grown-ups. But please, I'll begin my presentation. So our company is working on percutaneous coronary intervention robot. So we are aiming to provide a value that can go beyond robots. And based on the past research, we conducted exemplary clinical research, and now we're working on it. The background is that we're based on Seoul Asan Hospital. So based on that medical technology, we're bringing that to life. We were founded in 2019. It's a very small company with 14 members. In 2020, we began our project more actively. We came up with a project, and we received a reward, and we got approval as a venture capital. So we actively is working on our clinical studies. What we're focusing is heart disease. The texts are really small, but there are various heart-related diseases, and the red circle parts are our targets. When there's an heart failure, then the heart would stop. But recently, we inject this intervention robot in the vessel to conduct operation. So we are working on producing those robots for operation. These two, coronary angiography and coronary arterial intervention, are our main keys. So we monitor and inject robots and inject stents and conduct operation. So those coronoscopic vessels, based on the videos, medical doctors decide what to do with those vessels. So we wanted to come up with something more than that. So there are a lot of patients back in 2019. The intervention surgery, like using the vessels or conducting stent surgery, there are 80,000 patients, and there are patients who got diagnosis, like there are over 200,000. And when you go to the United States, the number is even bigger. Based on the research paper here, the number is this. Then stent intervention, there are about 1 million surgeries in the United States, and also in Japan, about over 1,000. And in China, about 700 to 800,000 patients who go under this surgery. The surgery itself may look very simple, like using a guiding catheter to guide the catheter, and then you inject a wire and conduct surgery. But you have to look at a non-visible parts, so you have to use radiation. So patients might get exposed to radiation, so you need high skills to operate precisely, and it takes a lot of time. So even the operator and the patient, they both have limitations. And this is a small research paper. So medical doctors would make their decision. However, if you dive into the details, then when it comes to diagram, so considering the length and diagram itself is really challenging. So medical doctors have to train themselves. However, it's really difficult to come up with an optimal operation. And this slide is for lack of proficiency. You need a lot of time to train. So on the first year of fellowship of medical school, they get used to it, but getting rid of those clocks is really difficult. And nowadays, the number of those specialists is lacking more and more. Korea does not have relevant statistics, but in Japan, many thousands are in short when it comes to specialists. So we wanted to use robots to narrow down the gap between supply and demand using this percutaneous coronary intervention. So there are various ways. Those manual operations in the past can be replaced with robots. So medical doctors' decision can be aided with artificial intelligence to raise accuracy. So the tool between that connects humans and robots would be our technology. And one dramatic effect is that we can deal with acute myocardial infarction. So nowadays there's increasing cases and deaths. I personally haven't heard, but there was a TV documentary program. When you go to Ulung Island, there is a hospital for this. However, there is a hospital, but in short of medical doctors. So if there's a patient, you have to use a helicopter. Of course, they are close to the hospital, but still you have to use a chopper. So this is our goal. But our competitor, the United States or Germany, there is a competitor company who actually is practicing remote diagnosis. So this is different from operation because operation needs more details and complex technology. But if it's not operation but monitoring, then as long as you can come up with accurate monitoring aided by medical doctors, then you can come up with a very efficient way. But as you may know, there are many constraints. So realistically, it's very challenging. But if we use robots, then we can still benefit from this. So it's not only us who thought like this, but there are many competitive competition companies in the market. It will likely increase. There are some like trillion Korean won worth scale or others the market would be. But what we think is that the surgical, but compared to other market, we're in the early stage. The market itself is in the early stage, and now because of the COVID-19 pandemic, every company in this field is at the early stage. Of course, we might be quite lag behind, but we can follow up in this field. And there are two big companies, Corindus company. So when it comes to Corindus, I'll elaborate later. But Corindus is acquired by Siemens in Germany, and we are currently following them rapidly. And we have been developing this technology for 7 to 8 years, and we have began our vascular surgery robot back in 2017, and we completed them. And there's a video, I'll just skip it. And here, back in 2019, in October, we conducted our exemplary clinical studies, and currently, after the exploratory clinical trial, we're completing our second trial, and we have reached the level of other competitor companies overseas. And now we want to come up with a more strong device, working on AVR 2.0. And here are our techniques, technology. They're not yet perfect yet, but for those surgeons, they say they want this feeling of manual operation. So we have to provide them with the sense where you can interact with your hands and the robots. So we have secured that technology. We, based on our haptic devices, thanks to the haptic rendering, we have this technological strength over other competitors. And this detail is that it requires a lot of high difficulty operation. And other competitor companies, they are focused on relatively easy operations, but when you want to use them to highly difficult operations, you need more complex technology. So that is what we felt when we worked on our Aviar 1.0. So we upgraded that in our 2.0 model. And when it comes to medical robots, there are key mechanisms and there are other aspects that you have to consider, like at labs, at hospitals, or research institutes. When it comes to cardiology, there are a lot of researchers who are interested in this, and there are a lot of bodies of research. Like there are a lot of papers. But actually, when you jump into the market itself, when you want to actually use them, you have to think about various details. For example, you can see on this slide, we have considered various details, the sizes, the angles. If you make one single mistake or error here, then there are a lot of difficulties and challenges that the machines wouldn't work properly. So we want to go beyond those issues by overcoming the difficulties. So we are breaking the challenges. So that is what that is a strength of ours. Now we're living in the era of artificial intelligence, and one is like auto operating, just like self-driving cars. We can think of self-operating robots or doctors. They need a lot of skills in order to properly read and monitor and analyze data. So when they reach a risky part, then you can get alerted. So then you can prevent risks. So we have reached that level. However, since this is a medical device, we have to get licensing. So there are steps to take. So we are planning to work on the safety issue, and also when it comes to self-operating, we did complete that stage through animal experiments. Then we will move on to the next step. But in the past, when human doctors used their hands for manual operation, now, in the long term, we have to move on to shift to the next stage where robots can operate. So we made a prototype for AVR 2.0, and as I told you, we already completed the feasibility with AVR 1.0 2 years ago. And internally, we have discussed various issues and came up with many internal systems needed for our project. So today, when it comes, we are currently working on the second day of GMP experiment, and there were no issue. So based on our independent own manpower, we have our own capacity to work on this. So in the second half of this year, based on our 2.0 model, we would like to move on to the confirmation trial in the end. And we are currently working on to expand to the US market. And 1 week ago, we got the result of the pre-submission of the FDA, and I think we can move on to the world class market. So we did get that assessment. However, one thing to worry about is that only based on our clinical results in Korea, it might be difficult to get recognition in the US market. So that is my personal worries, but I wish many good investors would show up to help us. So we are not just focusing on building robots, but we have this common sense. Like many people can come up with creative operative measures and come up with a lot of different ideas and share them on our platform or infrastructure. That is our ultimate goal. And the insurance is another challenge, but I'll talk about it in detail. There are other diagnostic machines like ultra radio, UV, or other OSCs, among others. Patients have to pay with their own money on top of the coverage. So medical robots require a very high cost, but thanks to, if we successfully adopt this medical coverage, then that medical expenses will decrease. So if we successfully do so, I think this will bring a lot of potential effects, but might be challenging to complete it. And our company is not just a company who just popped up from nowhere, but we are based on this hospital, and we do have backgrounds. But of course, our company is a small one, so we need a lot of affiliation or partnership. And if we successfully secure our my background, finances or backgrounds, then we will be able to expand our business. And how and when and who and who should pay for this project is one of the worries that you suggested. Then, of course, we do have those issues. You can use this robot. That recognition might be easy, but who should purchase it and who should use it? That is another question. And we need a huge number of clinical history records, and we have to pay for the expenses for the clinical studies and those clinical patients. That might be a challenging part, but the effectiveness of this medical robot is so obvious. So if we successfully make it sure that everyone can trust that this robot is very effective, then we will resolve that problem. Another foreign case is Siemens acquired a company to work on it, and also China acquired a French company to work on this field. And also, we also is working on a futuristic plan to develop our robot. Another thing is that we are living in the era of COVID-19. That what if we had a much advanced robot? Then maybe we could have provided much more better medical services to patients. So in order to prevent that from happening again, we wanted to come up with a solution. That is the end of the presentation. Thank you. Thank you. A differentiated capacity, the robot company, LN Robotics. So I could feel the passion of the CEO. Next, we'll move on to the next company, Universe Global, presented by Professor Lee Sang-yeon. Please welcome him to the stage.
안녕하세요.
Hello, everyone. My name is Lee Sang-won. I'm a leading Universe. I would like to briefly introduce our company to all of you. We are a cloud-based digital healthcare leader, and we would like to innovate
클라우드
healthcare system by utilizing our technologies. I know that this is utilized in many different healthcare, but maybe this is your first time hearing about our company. Before I became a businessman, I was a orthopedician, and I developed a medical device that uses a spine treatment without any surgeries. And because I became a researcher and developer, I decided to talk about or challenge our future treatment, future care, and I was leading this type of research, and I was assigned as a national project leader and researcher. I decided to combine cloud and big data into medicine, the field of medicine, and this project was completed successfully. And you can see that for the first time in Korea, Korea University Medical Center is now being operated on cloud. And last year, as a result, I was awarded with the merit of Medal for National Merit. So you can see that we are preparing for the fourth industrial revolution, And we would like to build a hospital information and data collaboration tool using cloud. And back in 2019, even though we are creating hospital information system using cloud, in order to actually realize the vision, the company has to be there and to spread the system. We can't just simply develop and invent and stay there. In order to realize our dream, we needed a company. That is why I decided to build this, and we attracted Series A investment from Naver, which is 2 billion Korean won, and we also got another round of funding as well this year. So people talk about fourth revolution, industrial revolution. Then we have to think about how is it different between the first three industrial revolutions versus the last, the fourth industrial revolution. In the past, it was mostly about increasing the supply, steam engine, vehicles, electricity. That's the supply of revolution. Whereas if you look at the fourth industrial revolution, it focuses on consumption. If you think about autonomous driving, you have to provide customized service to customers to prevent collision between cars. To enable this environment, you have to understand the consumers by utilizing sensors, 5G, cloud, big data, artificial intelligence. And by converging these elements and technologies, you can provide customized data to a specific vehicle. So I think the same goes for medical areas as well. You have to monitor similar patients that are 10,000s or more in number who have a very similar trajectory when it comes to your own disease, and you compare the data, you learn what was effective for them, and use the same cure or treatment. So you have to collect the data, including genes, very carefully and cautiously. You have to look at the current system. There are different terminologies. All the data are existing in silo. And if you want to combine all the data, you have to put in a lot of resources just to map the data together. But usually you tend to use just one hospital for data. But let's say at cloud, there's the best hospital system, management system, and if you use it for as like a crowd funding or pay, then even though you belong to a different hospital, you can collect the same class of data. And I believe that this combination and gathering of data will be able to provide customized care and services to us. So let's watch a video together.
정밀 의료란 개인의 유전체,
What is precision medicine? It is including gene and habits and personal information, and by gathering the data points, you provide customized care. If that is so, cloud-based hospital information system, what does it mean? PIHS is innovative. The existing IHS system, whenever a patient enters a hospital, you would have to provide your information separately every time. But under the current system, even if you go visit a different clinic or hospital, there is a continuation of care. So, precision IHS is also very economical. You can say that the cloud-based hospital information system will enable a collaboration and mapping of different data points. You can save costs for managing the data. You can also encourage sharing of data between hospitals, so you can suggest customized care and prevent overlapping and redundant diagnosis and tests. The PIHS system is also very productive. The PIHS system has no limit in terms of time and space and can share accumulated data that can encourage collaboration and research by multiple doctors. And this will lead to the nurturing of talent, which will contribute to the increase of national capabilities. The system is also efficient. Storage and performance can be improved quite easily, and data backup and security system will be maintained under the anonymous environment, so there's less chance of privacy information leak, and comprehensive diagnosis and visuals and customer and patient information will be shown as a dashboard so that doctors and physicians can utilize it very efficiently, and you can also use visuals so that nurses can refer to the ongoing process of patient's care. And mobile EMR, live log based PHR, chronic disease risk care, intelligent POC prescription guide will be added to the system as well. Starting from Korea's Annam University Hospital, after the stabilization period, we are going to expand to other locations as well. Large hospitals' IT systems can be adopted at small and medium-sized local hospitals. Precision Hospital Information System. The time for treatment is going to be shortened, effect will be heightened. With precision technologies, there will be the fourth industrial revolution adopted in the medical industry, the total innovation of hospital information system. It's a perfect completion and employment of IHS. And at the center, there is cloud-based PIHS. As you saw from the video, so far, if you look at what has happened around the world to care for cancers and rare diseases, when there was no case where we uploaded data on cloud, but for the first time in Korea, uh, thanks to the support from the central government, we successfully uploaded the data on cloud. When we first tried, everyone said, "Oh, this is not going to work." All the other partners, including Samsung SDS, they said it's quite risky. There is not This is not going to work, and they said, why don't we just apply it to a small local hospital instead of the Korea University Hospital? But if that happens, that big data is not so meaningful or remarkable. If you want this to be useful for cancer patients and rare disease patients, you have to target a center that is large scale, which has comprehensive data sets already stored. So as a result, we targeted Korea University Annam Hospital, and this worked. So all three hospitals under the Korea University chains, Annam, Guro, and Ansan, they're all being operated on PHIS, and the officials there don't know whether it's on cloud or not. They just use it without feeling the difference. And Samsung SDS invested 100 billion won, and then the government fetched 30 billion won, and Korean University Hospital also invested additional 50 billion won, so that all the patient-related systems are established. So I would say that the research size when it comes to funding was 180 billion won, and because the information is now uploaded on cloud, all the other hospitals, they can just simply subscribe to it and then use it. And because it's a shared economy, they will be able to benefit from the best program and best system with economic benefit. And Samsung Hospital, Korea related university hospitals could be their partners so that they can build new AI solutions in the future. So, as I shared earlier, the system is innovative, economical, and aligned with 4IR technologies. And I think what's most important is its security. We are using Naver Cloud, and after the foundation of Naver Cloud, there was no meaningful security accidents that have occurred at Naver. Hospitals every year, even major university hospitals, there are security leaks and accidents that happen regularly. But on cloud, just like how we put our money on banks safely, um, there is less likelihood of leaking the data, unlike a personal wallet or how we save our money individually. So, what's important in big data is, of course, standardization of clinical jargon and codes. And we have been working hard to standardize the expressions and jargons, and these words are going to be used. And the ADM MDM service will automatically update other hospitals' usage. We can diagnose, address, and evaluate their jargons. And all the data or standardized expressions and codes are going to be adopted, and these ones are aligned and mapped with global jargon as well. So what's expressed here in the crimson color, even though we are different hospitals, we use the same jargon. So basically, all data sets can be utilized as if they exist in one hospital. In the past, you had to map them before, so only 20% would be used for CDW. It's okay, it's quite useful if you want to just look at the trend, but to be able to actually build useful AI system, I would say larger coverage was necessary, and we finally made it. And by combining all data, including life log data, clinical data, and genomic data, you can see that it's an integrated platform that deals with all different types of data. And you can see that all systems were developed by modules. So a hospital can use as many modules they want, and then depending on how many modules they use, they'll be charged accordingly. And because it's uploaded on cloud, the benefit is that you can utilize open API gateways for making or exchanging interfaces. So if it's already uploaded on Naver, then it's easily accessible. For example, electronic user agreement or insurance automatic billing. What they had to do was they had to come and develop interfaces to get the data, attract the data. But because it's on data, all hospitals that use PIHS can use it all at the same time. So I can see that our benefit, the strongest point, would be security. I think more and more hospitals will flock to the cloud environment just for the security reason too. And another biggest benefit I see is that a database is upgraded into Tibero. So in hospitals, because of the importance of data, they use Oracle, and the cost is huge. But if you were using Oracle as a database, then we will be tied to them, and there's no clear benefit. So we challenge yourself to come up with a domestic technology. And Korea University Hospital, after changing to Tivero, the cost went down by 60%. And I think other hospitals will also benefit from this usage as well. And patients, as a result, in the past, they had to click 8 times to use a service, but now they can access their information much quickly and easier. And depending on different timelines, let's say surgery records or, you know, doctor's visit records, all these tabs are readily available, so they can click it and see what was discussed. It's very user friendly. And moving on to the spread of the use, there are many different costs that are related to IHA service, but the biggest cost would come from maintenance and repair. And you can see that 40, 50 people are there just for maintenance. But if it's on cloud, then uh, let's say there's one team that'll be in charge of 2, 3, 5, 6 hospitals. The number of personnel required for maintenance is not proportional. So let's say there are 20 um, hospitals, you only need about 40 people instead of having to hire 100 people. So as a result, it's very flexible and cost effective as well. And because it's connected to university level hospitals and local governments, and this use is going to spread as well, we're going to create a council so that more hospitals can come in and utilize big data that's generated in our system. And we will also go into other markets such as Thailand with Naver. So I can surely say that we completed PHIS, we created a platform. We will continue to build on from what we have with other hospitals and create business opportunities as well. So currently we are on Series B. Series B funding is all over. At this Series B stage, we said we will work on AI connected platforms, but on Series C, we're going to go global and we will strengthen our big data research. And as I said earlier, the fourth industrial revolution, we have to focus on patients and consumers. We have to provide customized precision medical care. And life data has to be gathered at one point on cloud, and you have to be able to see other data that's similar to you so that you can prevent some diseases that are likely to occur in your body and then have a seamless solution to prevent that from happening. And for this to happen, more and more hospitals have to come and join the same service. That is why we created this, and I hope that more people can join our journey. Thank you very much.
Thank you for your presentation. It was CEO Isangan of Universe Global. Well, let's move on to the next presentation. Next is Director Cho Jeong of Tetra Signum. Please welcome Director Cho to the stage. Good to see you all. I'm Director Cho Jeong of Tetra Signal, and I'll present about CBS's platform introduction. Originally, CEO Chun was supposed to present today's event. However, because of his personal circumstances, I will be the presenter today instead of him. Nowadays, the medical field is so advanced and professional that when it comes to education, prevention, diagnosis, and therapeutics, there are various technology and methodological issues, and there are a lot of inefficiencies. And our company, Tetra Signum, based on XR, we would like to get rid of that inefficiency with our advanced ICT technology. So we are putting efforts on that regard. Our vision is using the potential XR to cover diagnosis, treatment, and education and prevention. So we will provide various healthcare solutions. By year 2025, we will be the global standards of VR healthcare. So under that motto, our staff members are working hard on it. So IT technology in the medical field needs a convergence of two different fields, and that is really difficult to approach. I will, of course, mention it, elaborate it later on, but Tetra Signum has a lot of specialists in various fields like surgery and chest surgeons and mental disease, among other fields. And we make use of this XR and big data, among other high-tech ICT technology to bring this to life. So I'll move on to details of our company. It was founded in July 2019, the first of its kind of bringing virtual reality CPR device. In 2020, we got approval from KOTRA and Ministry of SMEs and Startup, and we won our patent, and currently expanding to British and among other countries. So we're working on MOUs to expand to overseas market, and including Minister of Welfare, among other special experts, are directly providing their support, and including our CEO and other medical specialists are directly engaging in this field. And after this approval and licensing, ICT professionals are realizing this idea and work on marketing and sales, and that is a process. Well then, let's move on to our CPR training and education. Before I move on, I'll show you a video. It'll take about 5 minutes. On a day, there is a man in his 60s suddenly fall on the floor because of a cardiac arrest. A lot of citizens gathered together to help him, and there was a firefighting truck who stopped to help this gentleman. Let's take a look at the CCTV video clip. Reporter Han Ji-won. In a daylight, a man was suddenly fall on the ground. His company gets confused, and a woman rapidly rushes to him. Without even dropping her backpack, she begins CPR. They were total strangers, but all the desperate help continued for 3 minutes. Then a firefighting truck stopped on a red light, and a citizen stops the truck and asks for help. And a firefighter replaces her and begins CPR very quickly. Another firefighter brings in automated external defibrillator to the patient. So we just finished firefighting in nearby Songpa, and a citizen came to us and asked for help, that there is a fallen person there. Thanks to the rapid response and the ambulance, an amalgam of a fire pump truck and ambulance equipped with AED, all the three factors coincided to save the life of the gentleman. The woman who did the immediate CPR did not leave her name or contact number and just left the place. I feel so thankful that they saved my life. And I was so lucky, I think. So thanks to all the response, I saved my life. I feel so thankful to them all. Han Ji-won from SBS. Like you just said, I saw. So as of 2018, there were about 30,000 cardiac arrest patients. And it happens in our daily lives. And unfortunately, 95% they lose their lives or they fail to go back to their daily lives, especially in Korea. Only 2.4%, Japan 8.8%, United States 9.6%. As you saw from the video, when a patient suffers a cardiac arrest, after the golden time, 3 to 4 minutes, the death rate significantly increases. Even in Korea, where we have a good medical system, it takes about 7.5 minutes for an ambulance to approach. So there are continuous happening of these unfortunate cases. On the other hand, people at the age of 19 or older, back in 2019, only 38% of grown-ups experience CPR education, only those nominal theories or training, like lectures. So there is a raising question if they are really effective. So we wanted to continuously provide high-quality, experience-based training so that citizens without any hesitation or worries, can they conduct CPR on patients. So self-driven education solution was needed. So that's why we began developing this service. So not only in Korea, but it has marketability overseas as well. So this is the CPR education system where medical staff or other ordinary citizens can easily learn and practice. So it's a self-driven solution, like streets, classrooms, like schools, or anywhere you can set certain situations in the application and learn the accurate CPR measures. So when an emergency actually occurs, you can conduct practice CPR with confidence. So this will change the paradigm of CPR training. And I'll move on to our product details. A touchable display and various sensor adapted mannequin and VR device that can increase the sense of reality. And on top of that, we also provide digital content based on VR. Based on the CPR system, we have a patent. So consistent and safe education is secured, and various trainees can get education, and there are sensors for each steps. So we can have a qualitative approach to analyze the results. This is a sample screen of the VR application. And here is a sample video. So you just saw CBS 2.0 VR education content. You don't need a specific installation or manual, and you don't need a separate instructor. So everything is done all in one on the screen, and the trainees training will be analyzed from the sensing. So it's very easy to use and convenient system. But the CPR Association's official guideline, we follow them as well, and very renowned medical experts from home and abroad provide ideas. So based on that, we designed various scenarios. And when you use this CPR platform, the medical costs and HR costs can be reduced by 60%, and the education time can be less than an hour. And especially there's no spacious or time constraints. You can go do one-on-one self-driven education. So it's likely to increase the education efficacy by 400%. The self-driven CPR platform analyzes all the interaction of the trainees and trainer, and not only the time spent and how deep the compression was made on the chest, the consciousness and breathe, among other like 20 categories. We accumulate data and analyze them. And in order to advance CPR education, we make use of them to come up with an even more advanced technology. and each hospital or official offices, among others, can make use of this guideline. So far in Korea or the US, UK, Singapore, like those hospitals are making use of our platform to work on clinical research and work at public organizations, and they're expanding the scope. This is another slide. The CBS 2.0 that we recently developed. We're working on marketing and business. So based on the demand, there were some demand for customization. So this is a CBS Mass model, which is aimed for a number of students that can be trained at the same time. So we're working on this. We're planning to launch this business in June. CBS Mass uses VR and monitors, so you can simultaneously conduct education in two different ways. So a big number of students can learn CPR, and the instructor can use a all-in-one tablet to see all the students' information real time and correct them. And after the training, they can analyze the data and come up with score rankings and analyze the results and manage the data. And also, the sensors, location or pressure sensitivity, tilt sensitivity, among others, can be considered to come up with a real-time platform, and we can come up with infant-oriented hardware and software. So we're in partnership to come up with a mannequin. So anywhere, any place, anytime, even young people, the youth can learn CPR. So we want to broaden the scope of CPR education. And here is a child who receives CPR education, and we'll take a look at how he acts after this CPR education. Hey, I feel so dizzy. Hey, excuse me. Hey, are you okay? Hey, excuse me, please call Korean 911. Please call the ambulance. And please, man in blue. Please ring me an AED. Sure. Hey, why are you pressing here? You're not counting numbers? 22, 23, 24, 27, 28, 29, 30. Hey, you can stop now? So based on the advanced medical expertise and technology, we learned that how difficult it is to converge the two. But if there's a way, then we can actually come up with a way. So we, staff, are putting all our efforts on this. Thank you. Thank you for your presentation. That was the last presentation of session 2. Director Jo Jae-young of Tetrasignum, thank you for your meaningful information. So that was the end of all the discussions and presentations. And thank you for being part of today. I would like to extend my gratitude. So from session 1 to session 2, We covered metaverse and biohealth. There are responses. So there was a very active discussion and presentation. So it was so meaningful for you to interact your information. So I wish it was a meaningful time for you. So I wish today's event becomes a opportunity, a cornerstone for other biohealth companies to expand their business into Korea and abroad. So that is the end of Biokorea Investfair 2022, Day 1. Thank you for participating here and everyone, both online and offline. Thank you. Biokorea Investfair 2022 will resume with session 3 at 1:40 p.m., beginning with mRNA and vaccine CMO, and session 4, Korea's other funds, will be covered tomorrow. So please keep your attention. Thank you. And from the 17th of May to 23rd, Bio Korea Investfair 2022, you can watch the videos on the official website again. So please note that as well. So again, I would like to express my sincere gratitude. Thank you.